Hello, namaste, bonjour à tous, comment allez-vous? Bien, merci. Hello, my shining stars. Welcome to another very prominent episode of IFL-SC Global Academy. Today we are looking at something very important that concerns you, that concerns me, that concerns all countries. We're looking at health communication diplomacy. That's very important. In French, you call it la diplomatie de la santé. In German, you want to say diplomacia de la comunicación en salud. That's in Spanish. Diplomacia de la comunicación en salud. Then in German, you want to say Diplomatie der Gesund heißt Kommunikation. Diplomatie der Gesund heißt Kommunikation. Now, it sounds a little technical, but it simply means how governments, how health leaders, how organizations talk and work together to protect the lives of their people, the lives of their citizens, especially during pandemics, when there's an emergency. How do these governments, how do they coordinate together their effort? All of this supported by the SDGs. We talk a lot about SDG 3, health, SDG 5, gender equality, SDG 16, peace and strong institutions. These are very important. But first, you know what to do. Please subscribe, give us a thumbs up, and share these very important videos to all the women, the girls, the boys, the men around Africa and the world. Because our mission here is to make you great. I mean, GREAT, the great agenda. G for gender equality, R for reality into action, E for education and empowerment, A for action for climate, and then training. T for training for the future. You see, that's the path that we walk on this program. And guess what? You too can walk that path. It's very important. All right, let's dive into the conversation now. Health communication diplomacy. What do we mean by that? We look at the powerful intersection of global health, strategic communication, and diplomacy. That's a field now, it's now recognized as health communication diplomacy, that intersection. But why is it important? It's very important because health transcends everything. Health transcends borders. It's not a regional something, it's not a country something. It goes beyond all borders. That's why it has to be communication, it has to be interaction, it has to be diplomacy, cooperation, so that people can survive. So we want to look at what is health communication diplomacy, why does it matter? Do we have some examples here in Africa, especially in West Africa? Now, what is the role of some health organizations? For instance, the CDCs, the Nigerian CDCs, the World Health Organization, the WAHO, what have they been able to do to use peace, to use communication to save lives? Now, first of all, what is health diplomacy? Health communication diplomacy. Health communication diplomacy simply means, I just want to simplify it for you. It is a smart and respectful way that countries and institutions share information, build partnerships, and respond to health challenges, especially in a peaceful and coordinated way. It's simple as that. It's just the way countries, health institutions respond to challenges in a peaceful way, in a smart way, in a diplomatic way, with clear messages to the public, with cooperation between countries to stop the spread of this pandemic, making sure that it's including women, elderly, the rural communities. No one is left behind. Even respecting the languages, the culture of the people, the traditions, while communicating about health. It's just about that. So in short, health communication, it is health communication with respect, with strategy, and global cooperation. So is it important at all? Oh yes, sure, it is very important. Look at what happened recently when the COVID-19 pandemic, when it hit the world. You see that lack of communication and misunderstanding made things very worse. Those of you who would remember, you remember that people didn't even trust the information they were hearing. There was a lot of confusion about information all over the world, not just in Nigeria, not just in West Africa, even all over the world. Some countries started fighting themselves instead of even helping each other. There was a lot of rumors. But we looked at it that when some countries and health bodies used diplomacy, they used communication. What happened? People began to feel united, they began to feel included, they began to support, they began to have the right information, and it was reaching the right people, and it started saving lives. So this is why communication is not just about talking, it's also about building peace, it's also about building trust, unity, and in health responses. Now, let's look at our region where we are now. We're in West Africa, and we have many health challenges. We know the Ebola outbreak in Guinea, Liberia, and Sierra Leone. That was between 2014 and 2016. We're all aware of that. We know about the COVID-19 across West African nations. We know about Lassa fever. We know about cholera. And the famous malaria, which is still causing a lot of deaths every year. Malaria is even what we call an endemic disease, which means that a disease that people are used to, the mortality is known, people are even expecting that that's how it is. It's with us. Malaria is really with us, But during the Ebola crisis, one of the biggest lessons that was learned there was that poor communication made people afraid during Ebola. People didn't even believe that Ebola was real because of that poor communication. Others rejected help from doctors. Some doctors were even, in some villages, some doctors were even attacked. Some nurses were even, attacked and humiliated because people initially didn't believe that Ebola was actually a threat. So what did we learn in that? We learned that local language translation is key when there are pandemics. That is where medical translation comes into play. That's what we work on in this program as well. We look at biomedical translation, we look at communication, we look at working with community leaders because it helps. Now, using radio, using posters, using social media, that can help spread the correct messages, respecting the people's culture in a respectful and diplomatic way, in a very tactful way. So when West African countries had to come together, they had to look at, okay, what do we do now? What's the solution? How do we share information quickly and respectfully to save the situation? So that's where the role of an organization which is known as WAHO came into play. Played a very prominent role. It's the West African Health Organization, WAHO, and the CDC. They all played a very big crucial role because most of you don't understand. WAHO is an organization which was created by ECOWAS because it helps the 15 ECOWAS countries share knowledge and respond as a team. So it works on early warning systems, it works on communication, joint training of health workers, sharing of medicine, sharing information, equipping people, coordinating communication in local languages. That organization does that. It's a specialized health institution of the ECOWAS, and it was established in 1987. So it coordinates that for 15 countries. All right. So we can see that some of their priorities include disease control, epidemic preparedness, health system, infrastructure development, pharmaceutical regulation, access to essential medicine. It's very important. Human resource development in health information system, and digital health. So you see that it's a very crucial role played by WAHO in promoting health diplomacy and regional integration in health across West Africa. Now, on the other hand, ECOWAS also did something. It has the ECOWAS, the Regional Center for Surveillance and Disease Control. We know about that. It was still established by WAHO, and where individual states also have what you call the national centers for disease control. For instance, the 15 states in ECOWAS all have that. Nigeria has its own Nigerian Center for Disease Control, which is a health body that works with the WHO and other organizations to monitor outbreaks, to train communication officers, to develop messages in multiple languages, encourage governments to speak with one clear voice. That's what it does. And this is all about health diplomacy in action. because countries come in helping each other respectfully. If you ask what's health communication diplomacy, you just have to say it's countries helping each other respectfully and quickly in times of pandemic, in times of health challenges. That's all. So in West Africa, the statistics reveal that the case of Ebola rate, the fatality rate, which is a CFR, of a disease like Ebola ranges between 25% and 90%. That is huge. Remember the notable outbreak in 2014 to 2016. That was an outbreak in West Africa. It was one of the largest ever, 28,000 cases and about 11,000 deaths. That's huge. While malaria, which has almost become our friend, our neighbor, the mortality rate, the fatality rate is estimated to be 15%. Malaria is endemic, like we said before, in West Africa. It's endemic. You know, it has millions of cases and hundreds of thousands of deaths annually. Malaria is endemic to West Africa with millions of cases and hundreds of thousands of deaths being recorded. I mean, malaria is still a problem till date annually. Now we also have in West Africa the cases of Lassa fever. Lassa fever's case of fatality rate, CFR, case of fatality rate, is typically around 1%, but it could be higher, up to 15%. That's a lot among hospitalized patients with severe cases. Now, an estimated 100,000 to 300,000 people in West Africa become infected annually, with about 5,000 deaths. That's a lot. Now, cholera, we've all heard about cholera. I have seen victims of cholera. No, the case of fatality rate of cholera is relatively low, 2.3%. We find out that the management issues can contribute to higher rates. Cholera outbreaks are very frequent in West Africa. So, what should we do? Take the case of Mali. Mali used drama, storytelling, people about COVID-19. That was the case in Sierra Leone. There were a lot of movies, drama, even in Nigeria. Remember, a lot of adverts on radio and TV. That's health communication. Moving forward, can we do better? Yes. We have to train more translators, more communicators in Africa. We have to support grassroots communicators, traditional leaders, women of faith groups, encourage African governments to make communication as part of their health diplomacy. This will also support SDG 3, SDG 5, and SDG 16. So, what are we saying? That health communication diplomacy is not just for presidents, it's not just for doctors. Yes, it's also for everyone who can speak, who can listen, who can translate, who can teach about health. So, use your voice. We are using our voices. You can also use your voice to build peace, to protect the poor, and make sure that no one is left behind. I am Marie, et je suis là toujours pour vous parler de la santé, and I'm here to communicate so that together we can save lives, communicate, and build nations. So please go down there, drop a comment, and let's have this dialogue. This is what I want you to know, okay? Your voice matters. On this platform, IFL-SC Global Academy, we build leaders for Africa, and you too, you can continue to follow us. Let us continue to build a legacy of purpose, okay? Oh, je vous dis au revoir, salut, bonne journée, Odama, Abwingang, au revoir. Thank you for now. I will see you in our next episode. Bye.